afternoon. My name is Jody Weinick, and I'm a retired garment worker from right here in the Lehigh Valley, from Allentown. I'm pleased to participate in this event as a board member of the Alliance for Retired Americans for Pennsylvania, an organization of seniors that has over 300,000 members and 144 local affiliates throughout the Commonwealth. Retirees like me understand better than anyone how important Medicare is to maintaining our quality of life. Seniors need a strong Medicare program that we can rely on, that won't turn us away for being too sick. I'm here today to make a stand against the Romney-Ryan plan to take that health care security away from the next generation of retirees. America must reject the Romney-Ryan budget that would cut Medicare funding by turning it into a voucher program. It takes away traditional Medicare benefits for future retirees and replaces it with limited stimulus to purchase insurance in the private marketplace and ends Medicare as we know it, leaving them at the mercy of private insurance companies. America must reject proposals like the Romney-Ryan benefit budget that shift Medicare costs to seniors. Under their plan, future retirees will be paying much more and getting less. How else would the plan save the government money, except pass the cost on to seniors? Studies by the Congressional Budget Office, the Kaiser Family Foundation, and many others will agree that all seniors will see a dramatic increase in out-of-pocket health care under the Romney-Ryan plan. Americans must reject proposals like the Romney-Ryan budget that raise the eligibility age for Medicare beneficiaries. Proposals that make future retirees wait 2 more years to get Medicare by raising the eligibility age to 67, leave them out on their own when they're most vulnerable. Retirees will either have to find a job that provides coverage at an age when most employers don't want to hire us, pay for coverage themselves at a time when income is likely declining, or become improvident to be eligible for Medicare. Many will choose none of the above and be uninsured at a time when they need to be accessing preventive care. These seniors will reach Medicare eligibility sicker and be more expensive to care for. I don't want my generation to be the last one that can comfortably retire. That's why I continue to fight for Medicare. On behalf of the Alliance for Retired Americans, I say to Mitt Romney and Paul Ryan that we won't tolerate their plan to rob Americans of a secure and happy retirement. Thank you.
My name is Mike Baker. I'm SEIU Local 668, Chapter 13 Chair of 6 counties representing Carbon, Monroe, Pike, Lehigh, Northampton, and Schofield. I'm here today because labor unions were part of the coalition to help pass Medicare and Social Security, and it's been labor unions and their allies that have fought to protect and expand those programs. In the beginning, conservatives openly opposed those programs, including minimum wage, claiming they would bankrupt the country and stifle business. But these programs grew in popularity, so much so that they became the third rail of American politics, meaning that to touch them would lead to your political death. Conservatives have continued to play the game, though, seeking to tweak and adjust the way they approach dismantling Medicare and Social Security so that they won't get electrocuted. At the end of the Bush administration, the term privatization became popular, and so they tried to create private accounts in Social Security. Americans easily saw through this ploy and rejected it. And now they're pushing what they call premium support, which is nothing more than a coupon to make health insurance cheaper. Medicare is a promise, not a coupon. And with only a coupon in hand, many seniors will go without. Amongst the American people, labor unions have credibility when discussing these programs because we understand the promises the programs represent. And we've gone to the mat to defend those promises and the middle class. And we'll be prepared to fight some more when conservative opponents come up with their next great idea to supposedly save Medicare and Social Security. Bethlehem Steel retirees were promised medical coverage for a lifetime. As the cost of the program for health insurance for them went up, eventually Bethlehem Steel discontinued it. It was eating up almost 100% of many retirees' pensions. My dad had a pension through the company he worked with, and for many years he had health insurance as a retiree through them. One year it went from $17 a month to $100 a month to $300 a month, so he dropped that and got on a Medicare supplemental plan, which was much cheaper. No way is a private industry going to make Medicare insurance more affordable than the Medicare program we have. Thank you.
Hi, good afternoon. My name is Eugene D. Pasquale, State Representative of Pennsylvania from the 95th District in York County. And I'm honored to stand with organized labor against the Romney-Ryan Medicare Voucher Plan. I mean, simply put, this shows how much ideology over actual what works and what doesn't has overtaken the Romney-Ryan ticket. The reality is that Medicare is not only one of the best run federal government programs, but one of the best run programs anywhere in the world. It provides great quality health care for our seniors, but at the same time, very small administrative costs. If this were to be turned over to a voucher plan in Pennsylvania, we would have enormous problems with our high numbers of seniors that would then be without affordable health insurance, that would really not only hurt the health care of our seniors, but really put our economy in a tailspin. So again, I'm honored to stand here today with members of organized labor and advocates to make sure that we improve Medicare, not get rid of it like Romney and Ryan seek to do. Thank you very much.
All right.